How can technology drive good? Well, in this episode of Tech Unscripted, Season 2, we're going to get into that in a field that I think really drives good when it comes to technology, healthcare. Gentlemen, introduce yourself. Grady.
Grady Nichols. I run the IT operations department at Mercy Ships.
Ollie.
I'm Ollie Chandler. I am part of the senior leadership at Milton Keynes University Hospital.
Milton Keynes University Hospital, Mercy Ships. Wait till you hear these stories. But first, we got to get some rapid fire questions. Rapid fire. Couple of words, maybe a sentence. Okay, you got it? All right, here we go. First one. When technology is working at its best in your organization, what does that make possible for people? Start.
I think quick access to the healthcare and the things that need a job, efficiency.
Mm-hmm. Ollie?
Same, efficiency. Technology sometimes can get in the way, but it's about removing that barrier and becoming an enabler.
Because people are the center, where you guys are at. All right, next one. One word. One
word.
What's one word your teams would use to describe your technology environment today? So your team, how would they describe the technology environment at Milton Keynes Hospital today?
Progressive.
Oh, interesting. Yourself?
Advancing.
Advancing. I like that. All right, we're going to find out about that. Why? All right, last one we got for you. Speed or stability? If you had to choose one, what matters more when technology is driving real-world outcomes? Speed or stability? Grady?
For us, stability.
Stability.
It's a tough one. Bit of both, I think.
Yeah.
I'd go speed.
Go speed?
Yeah.
All right, so what are you guys doing to drive both? Be fast and be stable? What are you doing?
So it's a fine line. We want to bring in change. Change brings disruption sometimes. So it's about an organization pulling together to be able to progress the technology that we need that benefits our patients and the staff, and do that in a controlled way so that we can progress forward and move on.
Do you agree with that? How different is that for you when you have floating cities? You have 2 floating cities around the world, around Africa.
I think massively. I think it's due to the locations we're at. We're not necessarily capable of working at fast pace with some time. Our bandwidth is limited to what the countries offer us and what our satellite does. So our floating cities have to operate solely on their own in case of that. So we need to be able to provide, that healthcare. The doctors can be able to have access to a state-of-the-art facilities that we have on the vessel. And I think for us, having that stability and power and all the things that come naturally with a hospital that's on land makes it easier for them to have access to it. It's not necessarily easy for us to have access to those things. We're dependent upon the ship for power and shore-based connections for a lot of that. And serving the poorest countries we go to, you don't actually have all those, first world granted things that we take, most people take for granted of.
Well, you've just teased an audience who may not know what Mercy Ships is about and what you do. What is Mercy Ships about? What do you guys do? How long have you been around?
So we've been around for over 45 years. We're a nonprofit organization, and we provide hope and healing to the world's forgotten poor. We do that through 2 hospital vessels. We provide free surgeries to those people. And not only do we provide free surgeries to those that not able to get surgeries or not have simple health care that we in modern age do, we also provide training to healthcare providers locally, because it's all set of numbers to the population to actually train healthcare providers there. So we're able to train healthcare providers. So when we leave, those healthcare providers can provide the surgeries and the stability that we have there, and they can use that training to train others and progress their country as we move on to another place.
Technology for good. I told them.
Exactly.
But what about a teaching hospital in Milton Keynes? How good is that?
It's very good. Milton Keynes is a wonderful city to live in and to work in. There's lots of opportunity and technology from lots of big companies from all over the world. So to be part of that is an amazing thing to help our population. We're one of the fastest growing cities in Europe at the moment. So there's an explosion of people. We're a very diverse area, but being able to provide healthcare in our community and be part of that community it's an amazing thing. And we deliver a lot of technology to drive efficiencies and benefits for our community. 550
beds, teaching hospital.
Yeah.
Part of the NHS. Get into that. What does that mean?
So in the UK, there's a National Health Service, which is made up of lots of hospitals and other facilities. So we're an acute hospital. We have around 6,000 users, roughly, of our service. so it's a busy site. We've built, on average, a new building on our campus every year for 10 years.
Whoa.
And that's, I think, going to continue into the future. So,
progressive.
yeah, Wi-Fi services everywhere, even outdoors. We cover car parks and so on. So as you drive in, you're online straight away. Quick, easy, fast access to services.
And what does technology have to do with any of this?
Well, we have to collect data and a vast amount of data.
Okay.
The human body is an amazing thing, and we've developed over the years, humanity's developed sensors to gather information about how we are functioning. And my job really is to take that data, make sure that we can connect that, and then surface that for clinicians to then make decisions about how people are treated and the right options for their healthcare.
Do you have overlaps in your job? What's your main role for Mercy Ships? And talk to me about how Mercy Ships is progressing. You're building a third ship, I heard.
Yeah, we're building a third ship, but I think for us, sort of the same means of it. But as you mentioned earlier, we have a floating city. So not only do we have a hospital that we have to support through technology to do the state-of-the-art hospital operating rooms and radiology equipment, we have to also have a marine part of it. The ship floats. We have all the operating centers of a full-blown vessel. We have a full-blown academy on the vessel, so it's a little city. We have families that live there. Over 500 and something families live on board the vessel. So we now have to support them from living conditions, a hospitality means, sort of like a hotel concierge service. It goes on with that. So all these technology we have on board the vessel has to be able to support and interconnect all these separate things to be able to ultimately complete our mission in that country that we go to.
I think I read that you've done over 100,000 operations.
It's a significant. We produce several thousand surgeries a year, and I would not even be able to give you the correct stats on over the amount of years how many surgeries we've done. But it is a significant amount of people that we have actually provided surgeries to that would not got it.
What do you think is your biggest challenge you have to solve daily? Is it the environment you're working in, an iron ship, floating, other countries, politics, or is it what you're trying to achieve as your end goal, making real business impacts? What's the challenge that you're most focused on and trying to solve often?
I think every day changes that challenge.
Oh.
But it kind of goes into, we're 100% volunteer based on the vessels. Okay. So which means volunteers come in, they can serve for 2 weeks up to 2 years on a vessel. So turnover is very, frequent on the vessel. So keeping that knowledge there on the vessel to be able to do these things, and surgeons to be able to come in and then outline these surgical plans, I think is one of the means. And then to operate in a country that, one is they're so far behind in the technology, lagging the technology expertise of what it is, being able to bring a state-of-the-art vessel there and be able to support that via bandwidth, like I said earlier, about power and all these little things that come naturally to a normal hospital land. It becomes a challenge daily to be able to make sure we can functionally do that mission to complete those surgeries and have the outcomes we need at the end of the day.
Do you have a similar challenge? Like, is this demand? Do you have a demand with how fast you're growing, how many buildings you're coming out of a year? The city is growing. Is demand your challenge? What is it?
It is, yeah, scale and demand. As I said, we're already building so many new facilities, and keeping up with that is a real challenge. But it's one that we're meeting, I think, and we're getting there. I can't imagine servers and so on a ship is kind of crazy. We have enough challenges on land, so I respect for you guys for that. But yeah, diagnostics is a huge thing. Connecting up scanners. We've even had to bring some of those in vans because there's just not enough facility.
Right.
So we connect those as well. But yeah, really good. Lots of demand and ever increasing. Also, I think efficiency is a key thing. Trying to get more out of the working day for clinicians is a really key thing. Lots of clinicians spend a lot of time and effort putting data into a system, and sometimes they don't really see the positive outcome of that.
Right.
So that's one of the key things for us is we're trying to deliver back useful data and information to frontline clinicians so they can make quicker decisions. Busy EDs and operating theatres. We deliver thousands of babies a year. So driving that efficiency by using technology to connect people together, decision-making, communication, it's a key part of what we do.
Yeah, I think you just answered my next question. But so we now know who you are, who you work for, and what you guys do in a nutshell. Let's define what we're talking about. How would you define technology for good?
I think it's about bringing people together to collectively build an ecosystem that works for patients and for the staff that directly treat those patients. And I think if you can get that right, you will create an environment that technology is used to deliver better outcomes for patients, quicker turnaround times for scans and diagnostics, more advanced, imaging. That's what we want to look for. And I think if we can use tech to drive those things, we're really going to improve the well-being and the life of our citizens.
And employees too?
And of course our employees, yes. We're of course users of our own service. So
surely you feel a lot the same way, but Grady, I'm interested to hear how you define it, and especially in the context you have to work, because often technology is met with apprehension, especially in some of the environments you may be dealing with in healthcare, right? But how do you define it and show people that what you're doing out there is for the greater good, not just for the people that you have to treat, but the people you have to work with to get in those countries?
I think for us, it's pretty simple. It goes to one of our core values. We believe in the 2000 model of Jesus Christ, and one of our values is love and serve others. Oh. So I think through technology for the good, we use the technology and our donors' money to fund the technology we have for the vessel, and the volunteers come to the vessel with the ultimate goal to serve others, to provide the healthcare needs or whatever their specific role is to serve the world's forgotten poor. And so I think for us, it goes down to the heart of what we are and who we represent and how we represent ourselves. And using that technology and those things we have on the vessel is key to be able to complete the surgeries, complete our mission. And we use that ultimately the best we can to serve others and to serve God and to make sure we can complete those services to touch other people's lives so they can get back to their community, they can get back to their ways of life to, hopefully go back to school, go back to work, provide for their families and become, better people in their economy and value to life to what they want to be.
Can you stop answering my next question?
We can try that. I don't know what you're saying. I'm not pretty good at reading mine. We can do the Jedi thing.
Because I was going to ask you, and you answered it in a recent video you did for Cisco.
Okay.
How do you measure success beyond the ROI metrics about how many people you treat and success or stuff? How do you measure how does Mercy Ships and then how do you measure success?
I think we can measure success in many different ways. We talked about earlier, we can count the surgeries. Yeah. So we can do that. Say we did thousands of surgeries a year. That's a great success metrics. But I think for us, you can go back, we go after a field service, years thing, we go back and can see the patients and see the transformation of their lives and what the surgery has done. And we can measure the matrix of not only to the patients we had, but to those pupils and those healthcare providers we provided training to, that years later, how many surgeries have they been able to complete? How many people have they been able to teach? And just to, in a sense, show the record of how we're putting ourselves out of a job, I think is ultimately how do we can go back and look at that and do that and just lives honestly touched. And if you watch the videos, you can see the kids and the families and they walk around with smiles on their face. And I think that, to us, to me, is one of our measures for success. If we're successful at changing one human being's life, it means a lot to us, and it means what most of our volunteers are coming there to do, to reach out and provide that hope of healing to the world.
What is your official title?
My official title is Senior Director of Information Technology Operations.
So you're supposed to measure success in no downtime, bandwidth, no, you're measuring success in real human factors. That's wonderful.
Yes. Yeah, and we can measure that. We try to measure it in no downtime. Obviously, downtime, that means we can provide that to the surgery. We can do all these other metrics that get into it. But at the end of the day, it's about the quality of life for our volunteers on the vessel and the quality of life for our patients. And we do our best to make sure there is zero downtime and the ability to do that. But it's not about the ones and zeros at the end of the day. It's a human factor at the end of it.
Ollie, that's hard to do for you. I suspect the same answer. How do you measure it? But it's hard to do.
It is hard to measure, yeah. What I would say, I think people are very good at telling you when they're not happy about something. When I walk into to an office or a ward area, one of my first questions is, what is it that IT can fix for you today? And sometimes it really is nothing. And for me, that's part of delivering a successful service. If people are just happy with the service that they have, systems work, they're quick and easy, that's kind of a big measure for me. So I guess the human barometer is a good one for us. Of course, we count uptime and so on. But I think that delivery at that coalface of the patient care, for me, that's where we focus a lot of our energy and our resources. And so if those guys are happy, I think that's a good measure of success for us.
I remember during COVID, some of the most powerful use cases of how technology in healthcare drove good is when patients can talk to their family when they were separated using WebEx. And it was really moving to see those connections and collaboration. And there's so many other use cases. Can you think of an idea of a particular technology that you see directly how it drives good, it makes a big difference in your workplace?
Sure. I think probably the biggest one for patients is Wi-Fi services.
Right.
So that's one of the things we focused on a number of years ago. We wanted to provide reliable, high-speed Wi-Fi throughout the entire campus and our other remote sites. And again, taking away those barriers, it's very quick and easy to get online. And lots of patients use that service to speak to families and so on. And just providing something that is relatively simple to do has been a huge benefit. We've got examples of where sometimes if your child is ill in the hospital, you can go home and you can still see your child in the cot because we have Wi-Fi services enabled to power those things. And things like that, when that's your child, is quite an important thing for a lot of parents. Free, quick and easy Wi-Fi throughout our campus is one of our main achievements that we are very proud of. Of course, and we obviously use Cisco Wi-Fi to do that. We're driving Wi-Fi 7 services forward and tagging on some other things on top of Wi-Fi.
Find out about that. But access to healthcare, that's one of the world's biggest challenges by far, especially where you are. What particular technology you think you see actually makes a big factor with some of those big challenges that we have?
From a patient side, I don't know if we have a specific technology that benefits in a sense to their willingness. We have Wi-Fi on the vessel and it's a unique experience, but a lot of them don't have the ability to utilize a lot. They come with cell phones. So we have Hope Centers in town that we provide services to as well along the vessel. So when the patients are there, they're able to keep up with their family members via cell phone or whatever technology they bring to the table. But I think for us, it really comes into our staff and our volunteers. And we have a full-blown academy on the vessel, so kids are running around. Every once in a while has access to Netflix and do their daily missions. So having that technology on board our vessels to be able to link up certain systems we have on the vessel to doctors around the world. We're not able to bring certain expertise to the ship. So to be able to have that technology that we can reach back and have doctors communicate and correlate to be able to provide a surgery to one person. For example, radiology, we have the ability to do radiology, but they're able to send the imagery off the ship to do imagery of that so they can actually get back down to do the basics, to be able to complete that surgery and bring clinicians around the world to the vessel without physically having to be there to be able to do that one action they need to do and perform.
I mean, technology is the foundation of this, but it's not the heart of this. The heart of it is the people. It's your doctors, it's the tech, it's the people. How do you guys help your people to do good for what they have to do? Anybody want to answer?
Okay. Yeah, I think we have an IT team on board each vessel, and obviously our ships are modernized using state-of-the-art technology from marine operations to hospital regulations, and our team on the vessel basically works with each individual business partner, each individual person on the ship to help show them the technology in which we provide, and it's in a unique environment. We can kind of talk about our ships a little bit to explain it. Let's talk about being a floating city. We don't have access to sometimes out in the world things, so each ship is divided into fire zones. We have one ship is 175 meters long, 13 decks high. We have 2 data centers aboard each vessel. We have IDF switch tech. So all this technology connects everyone together, and being able to do training to connect them together is key. And for us, we have a local day force. When we get to a country, we get a local day force from the local populace to come on the vessel. Multiple things. One, they get employed, and we get to employ them. But 2, when they're there, we were able to show them technology, show them skills, so when we leave that country, they can take those skills back with them. We teach Microsoft certification classes. We teach, depending on what their job is and what they want to do, we can actually take that technology and teach them classes so they're able to go back in their community and have a skill they can actually use when we leave.
Ollie?
So training, I think, is a key thing. We do a lot of training services within the IT department.
Okay.
One of my aims is to have as many CCNAs, in fact, more CCNAs in our hospital than any other hospital in the NHS is
cool.
one of my goals. So we provide lots of services. We take apprentices that come out of school and we train them up, and they get to experience what real life in a hospital is like, and educate our staff as well. We also, one of the programs we've done is to remove what we call clicks. Sometimes there's just too many clicks in a system, and people spend all their day click, click, click. And it's about finding some of those efficiencies to take away some of those things and working with staff, stakeholders to streamline systems to make access quick and easy. That's, again, a huge focus for us, and will be for coming years as well.
So you knew the script, what I was going to ask again. So we're going to segue now to the future looking forward. And I know, for instance, you are introducing a chatbot through AI. Looking ahead in 3 to 5 years, what emerging technology do you see out there that you believe can really drive meaningful change to continue the technology for good?
I think for the next 3 to 5 years, we're introducing a new ship. We kind of brought that up here. I think that's going to be our biggest technology advance to bring into the thing. To having two, the world's largest net geo hospitals providing countries to 2 separate locations is kind of all-encompassing. That technology, I think, is what's going to be life-changing for people. But I had to sit there and say one technology. I think AI does, with that new emerging technology we were able to present on these new ships. We're able to support now new features from like AI capabilities going forward. Yeah. We're able to potentially do, we get in the future of robotic surgeries and things that, introducing that kind of thing, being able to use that for doctors to actually, take notes, be able to do things with their patients. So we alleviate the downtime or the time that takes from that in between for the doctors and notes and the work they're having to do, be able to streamline that, speed up the process for them to be able to see more patients, do things in a more efficient way. I think that's some of our key things. And over the COVID, we were introduced to Teams, the Microsoft platform. I think everyone else is pretty aware and has do it, but for us, it was a great capability. We're now able to link people around the world and get skill sets around the world to be able to collaborate and do things moving forward that beforehand we were only be able to do locally based off our location in Texas, but now our staff has expertise circling the globe. We have people from Europe and Africa working for us, so we're able to do that 24-hour service to the ships and provide them timely expertise from just walks of life that we weren't able to do that before.
That's incredible.
Yeah.
Ollie, do you see similarities in where you guys are planning it to be?
Definitely, yeah. AI, it's a big topic at the moment. We are looking to bring in some chatbots for staff and patients to be able to call us and to be able to get a better experience, on that kind of telephone interaction piece. Also, we are now testing, actually, at the moment, what we call ambient voice listening. So we're now able to effectively listen into a consult, typically with a clinician and a patient, and we can then take that conversation, summarize that, which saves somebody typing all of that up. And we've built some intelligence into that. So we can now create orders for testing and for drug issuing, and we can automate a large part of that just from an AI listening in to a conversation. And then, within like 20, 30 seconds, all of that gets wrapped up. And again, huge efficiency saving. And I can see that the future of that is going to be, really bright. If we can continue to get the efficiencies that we do now from AI, I think the future is going to be amazing for those sort of things. Robotics as well. So we have the robot as well in our theatres. That's a really cool piece of tech, an amazing thing. But again, I can see that progressing and really taking off as that tech develops. It's getting better and better. The recovery time for patients from robotic surgery is significantly less than traditional. So it's less time spent in hospital. It's cheaper to operate, and it means people can come in and leave quicker. Nobody really wants to be at a hospital, to be honest. So if we can get you in, sort you out, and then pass you on, move you on, so you can continue your life, that's kind of one of our big objectives. I think also in the realms of medical imaging, I think there's going to be a lot of AI coming to that as well. I guess that's kind of harder when you're at sea. Yeah. But we have a few AIs that can do some cool stuff around imaging. I think that's going to continue. And we're starting to push that into pathology as well now. So we can take pictures of tissue on a lens, and we can, send that off to an AI to start to get some assistance in diagnosis. So,
Trying to think the things in my life I don't want people to make mistakes with. What I eat, when I go fly a plane, I don't want to have mistakes.
Yeah.
But definitely when I go to see a doctor, when I go to hospital, I don't want any mistakes. I want zero risk.
Yeah.
But you're introducing new technology. How are you balancing the two, really? How are you balancing, we have this new technology coming in, we're balancing the risk, so there's zero risk, yet we're still driving this increased good.
I think we introduced basically ARB, Architect Review Board, that we are able to take new technology, and they're able to kind of review it and see, will it work in our environment? Our environment's kind of unique to what we experience from other local hospitals, so we're a donor-based organization, so we want to make sure we're using those donor dollars wisely and introducing technology that will be efficient to what we need it to do.
Right.
And so they're able to review that, compare it to our current infrastructure. Will it be supported? And if it's supported, and if it saves downtime or saves hours of work, and it's efficient and it's a long-term cost of thing, we can actually evaluate that and come up with a solution to see if we want to bring it into practice or not, how it best suits us and our time and need. Because there's a lot of cloud-based technologies and a lot of things out there that's coming, and some of those things are just not currently supported where we're at, just based off our sometime ability to have that bandwidth to access things. So we have to just follow it closely and how it best suits us and our needs and capabilities.
Ollie, how do you balance risk and...
So it's, again, fine line. I think there's lots of examples where human beings have missed things, particularly around diagnosis in imaging and those sorts of things. So if we can use technology to improve that, I think it's worth doing, and we're kind of proving that it is. It's not about taking away clinicians, and we don't want to do that. That's not where we're going at all. It's about empowering them, I think, and giving them back time by using AI, and also prioritization. We have a very busy hospital at times, and some things can wait, and some things in a hospital definitely can't wait. And making that decision in real time is sometimes a challenge. So if we can provide data and diagnosis tools that facilitate that, I think that actually starts to reduce risk and empowers clinicians to make better decisions and save time.
All right, so I'm a filmmaker, and there have been technology changes all the time in what I do. I remember years ago, the big thing was 3D. 3D is going to take off. HDR was going to take off. It did. Is there a piece of technology that you guys planned for, you rolled out, it's like, maybe it didn't really work as well as we expected it to be, or maybe it evolved into something else unexpectedly?
Oh, I think it all works perfect.
Yeah?
Yeah, we have everything. It works amazing. No, I don't know if there's one specific technology. I think to us, it's not necessarily the technology. Sometimes it's how in which we roll it out.
Yeah.
We have volunteers that come in, like I said earlier, and having that technology not only easy access, but easy for them to understand and operate. So they don't have a long transition plan to learn how to operate this piece of gear, this piece of technology, I think is key for us. I can't think of one that is just blatantly just didn't work and we threw it out the door right now off the top of my head, because we tend to always think and strive for perfection, but not that we all are. But I think it comes into that user-based piece of it that wasn't necessarily a technology, it's how we introduced it to our environment. And we didn't properly go through probably the steps that need to be to get those users trained up, and they come in because they're coming from locations that may not have experience with that technology or piece of gear.
The question came from my idea in healthcare, how often they roll out perhaps a vaccine, and then they improve it, and it gets better and better and more specific, and there's positive feedback. Have you seen any of that when it's not worked, or you've improved upon it to make it better for your use case through trial and, not error, but trial and use?
Definitely. So I think probably every system we have has been through that evolution.
Right.
We deploy systems. We have nearly every clinical department has its own system that they use for their specialty, and often those systems day one are not quite there. So we work with lots of vendors, hundreds of providers and suppliers to improve those systems. And yeah, training, I think you mentioned training as well. So I think that's a big thing. I think that's quite overlooked, the delivery of training for, particularly for end users. So.
So you get a feedback though, and then that evolves. Where do you get your feedback from? I'm gonna ask you both those questions. Ollie, start first. How do you get your feedback to then continue, evolve, or develop something or build something that is needed for your particular case of Milton Keynes University?
So staff, again, very good at telling you which buttons don't work or where they want extra buttons. I think also one of the things that we encourage in the IT team is to ourselves look for efficiencies and solutions. So sometimes there'll be one of our devs will say, I think if I wrote something to do this thing or a web page to do something, we can fix this problem that actually no one's complained about yet. And that's the sort of thing that we want to encourage, of our IT service, to actually proactively start looking at things and saying, we can fix this problem that users haven't necessarily thrown up about yet, but we can see it coming, or we can see a better way of doing something. So we're going to create a system, sometimes a small app. A 3-page website sometimes can fix a problem for a clinician. You never know.
Because that's the importance to access to healthcare, is that it's inclusive and it's aware of the people who are using it and adapts to it. And in your case, you have users in Sierra Leone, in Madagascar, 2 very different parts of the world and countries, and many others. Talk to me about your feedback cycle. How do you continue to build things that are inclusive to the users and improve your services?
It's sort of a similar way. We get our users to provide feedback to us. We go out to the ships, and just from our IT department, we meet with our business units and verify, from them, what's working well, what's not working well, and then we can get their feedback on products they've seen potentially from their line of work or where they volunteered or they came from, and then we're able to introduce that through our, we have a project management team. So we're talking about the ARB, Architect Review Board, and we're able to bring that information back, and either we locally, the IT department, can potentially do some quick fixes, like you said earlier, to go back and help them improve a process or improve a way of doing business. But it's that really feedback we get from them to make sure this particular product or this particular application or technology is working. And if it's not, we can bring that to the appropriate parties for review and approval process to put something else, implement something else in place to solve all that problem. Just getting back to that basic functions and do the job the basic way, and getting the users to speak to that really is kind of to hone into that is really what you need to put your eyes and listen to. They're the technicians on the ground and the ones doing it. So just taking their feedback. And
what's your North Star shipping term?
God. Yeah, our values, love and serve others.
Yeah.
Strive for excellence, bring hope and healing to the world. I think that's our North Star, is focus on that, focus on what he's brought us here to do, and our mission in life is to provide that and just keep our eyes and focused on our beliefs is our North Star. Similar,
Ollie, what about you?
It's our people. The staff and the patients. That's where we focus, and they're the as I said earlier, we're users of our own service. So if I can make something better for me, it could be my family one day. My children need something. That's where we focus.
All right, before I ask a couple of rapid fire questions, do either of you want to ask each other questions? Because you both are remarkable use cases. Is anything interest you guys, or parallels, or you disagree with?
No, I think it's interesting for us to be able to get to a hospital that does training and work in a similar fashion. I can't say what one technology that you use that has helped you do business that potentially we could help us out in the vessels to do things a more efficient way that we're potentially not looking at.
So that's a big question, that, isn't it?
Yeah, I know. I had to ask the hard ones.
For us, I think is cloud. We use a lot of cloud services. I don't know whether that's going to work on a ship necessarily. I don't know. I'm not really familiar with the kind of connections you have. But I think for us, cloud has been a big thing in driving data. We have lots of data. In fact, our entire data warehouse is in the cloud, and we use tools to visualize that. I think that's been very, very valuable. So I would say definitely look at visualization tools and actually drive informatics back to frontline clinicians, I think, and also some of the business leaders. People, although we're a public hospital, obviously we still have to pay bills. We still have a finance team, a HR team, and those other back office functions. Those guys are still important as well to us, and delivering data to those people is as important as clinicians. I'd like to come aboard a ship and see a data center on a ship. So I'm guessing you host all your PACS systems, all your storage is right in the ship?
Everything's hosted on ships. We have 2 data centers there, and we would we love to have you on the ship. We have a volunteer webpage. Please go out there. We love to have technical expertise, IT field to come visit and spend some time on the vessel to be a part of it. But yeah, everything's kind of hosted there. We're trying to get more cloud-based. I think we were partnered with a company called SES. They provide our VSAT capabilities, and they're bringing this year MEO capabilities to our vessels, which will increase our bandwidth capabilities to potentially offer some of that cloud solutions and have more of a stable bandwidth for our vessels. So it's really glad to hear you say that and get involved. Yeah.
So your primary connection now is satellite for data?
Well, on the cells, primary is satellite for the cells. When we get to a shore, we usually get 2 local internet service providers. Depending on the country, it depends on the bandwidth and the cost. We try to have like a failover capabilities between the 2. So theoretically, we have like 3 when we're in countries, 2 local internet service providers, and our VSAT capabilities.
Okay, interesting.
Yeah.
Those were the good questions, finally. Finally, you got some good questions going.
Yeah, one of us gets to ask good questions.
But I don't have a question, I have a statement, and you're going to fill in the blank. Okay, you ready? All right. Over the next 5 years, technology will drive the most good when it
provides a means for volunteers and our clinicians to do their job in a more efficient manner.
Over the next 5 years, technology will do the most good when it
works.
Awesome.
That's an easy way of saying it. I like that one. Hey, it works. I should have. Simple words couldn't come to me.
It's exactly what it is. But gentlemen, thank you very much. You guys are definitely using technology for good. It's remarkable, and I really enjoyed that. Thank you so much.
Appreciate you having us.
Thank you.
Tune in next time for the next episode of Tech Unscripted.